The Department of Veterans Affairs says it's administered more coronavirus vaccine doses than 42 states and the District of Columbia. The agency has more than 215 vaccine sites across the country. Dr. Jane Kim is Chief Consultant for Preventative Medicine at the Department of Veterans Affairs. She's leading the vaccine rollout across the VA. Dr. Kim, welcome. It's good to have you on the program. Where is VA on vaccination distribution right now? How many shots have you given out? How many doses, et cetera?
Yeah, thank you for having me. So the VA has passed a major milestone this week in vaccinating more than 1 million people with a COVID vaccine. Now, many of those people are on their way to having the second dose. Many have already received the second dose, but we are just thrilled that we've been able to vaccinate so many of our staff and veterans. Out of those, about a quarter of them are our staff, frontline providers providing care in our hospitals and clinics. Just passed over 250,000 of our healthcare providers and essential staff being vaccinated with at least one dose of vaccine. So that is a great milestone as well.
How did you establish the categories of priorities of who to vaccinate first, who to vaccinate next, and so on?
Yeah, so the prioritization of COVID vaccine is really needed, as we all know, because of the short supply of vaccines as these vaccines initially launch and roll out. So VA did prioritize based on the Centers for Disease Control and Prevention's criteria, which look at risk. So risk of either transmitting COVID, getting really sick from it and such. So we in VA aligned with CDC's criteria to put our healthcare personnel and our veterans who are living in long-term care facilities as top priority. And when vaccine was authorized in December, went ahead and offered vaccine to those populations. And since then, we have really followed along with CDC's risk criteria to offer vaccine to our oldest veterans, and then to keep on working through as we get supply to veterans who are in additional ages and additional ones who have medical risk factors for severe COVID.
You mentioned the 250,000 of these vaccines you've administered to your staff. Do you have a sense of how many eligible employees are taking the vaccine versus declining? We're seeing some numbers that are quite frankly, a little troubling in the private sector.
Yeah, so what we did before this all started with the vaccination effort is to pull out from our employees who was or could be considered an essential employee in Veterans Health. And so those are not only our frontline doctors, nurses, and such, but also those who serve veterans in the facilities. It might be a clerk at the front desk who needs to, be in the facility present. It could be people who clean the rooms and nutrition and food services, et cetera. So we pulled all of those and called them essential employees. And I'm just really pleased to say that 68% of those employees have received a COVID vaccine to date.
Dr. Fauci said this week, Dr. Kim, that when we get to April, early May, it should be pretty much open season. Anybody that wants a vaccine should be able to get one. Is that the timeline to which you're looking forward at VA, that as more vaccines become available, you'll get to a point where any client and any patient and any provider that wants one, hasn't gotten one yet, will be able to do it?
Absolutely. I saw that Dr. Fauci had talked about that timeline to have a lot more vaccine available in April and even May, and I was just thrilled. In VA, we will definitely be looking forward to that. That is right around the corner. We get our supply in alignment with our proportion of our population, compared to the U.S. population. So I think as the whole U.S. supply increases, I anticipate VA supply will increase dramatically as well. And that's great news for our staff and veterans to have a lot more open access to vaccine along with the U.S. population.
I want to go to logistics for a moment, if I could, because we're seeing some issues in some states where they're struggling to get the vaccine out for the supplies even that they do have. What do you think was the thing that you did at VA early on that allowed you to get the vaccine out to the degree of success that you've had?
Yeah, so what we did last fall was, as soon as we learned that COVID vaccines were on the horizon for later that year, we started planning. And so we had some requirements from CDC. We knew that there would be a need for special freezers potentially for some vaccines and even regular freezers. We made sure we stocked up and had those freezers ordered and delivered before vaccine became available. And then we really worked hand in hand with the frontline decision makers and clinicians in our hospitals and facilities to let them know what was coming so they could start to plan. We have a national integrated health system, and so we were able to provide guidance from a national level, but we told people in your hospitals and clinics, start planning. And so I think it just was a lot of careful planning and attention to what was coming that led to our success.
Given that you had that infrastructure in place already, and given the fact that some of the vaccines on the horizon not only don't appear to need the deep freezing that the early ones did, but I believe the Johnson & Johnson vaccine doesn't require refrigeration at all. Do you think that your growth in the coming months will be exponential and not linear as far as the number that you'll be able to administer?
I sure hope that the VA's vaccination growth will be exponential. That would be great for our veterans and our staff and great for our country as we're all waiting for herd immunity to get us out of this pandemic. So certainly as Johnson & Johnson's product gets reviewed by the FDA and potentially authorized as well, it's a great option because it's much easier to store. It's one dose, which I know a lot of people will like, and it'll be a great additional option in addition to the more doses that are coming for the Pfizer Moderna products. So I sure hope that having all of these options on the table will help us vaccinate more people and again, get us through this pandemic.
We have less than a minute left. I know the science is not settled on whether we will need this on an ongoing or yearly basis like we do with a regular flu shot. But are you planning for that possibility now? Does that play into the way that you're figuring logistics moving forward, Dr. Kim?
Yeah, I think that we are definitely thinking as the science evolves that the COVID vaccines may be a yearly or kind of regular type of vaccine. So we're penciling that in, actually, more to come. But I think we definitely know that could be a possibility for us.
Dr. Kim, thanks very much for joining me today. I appreciate your time.
Thank you for having me.